Good evening, everyone. Without delay, let's begin the event. We request everyone to stand up and bow their heads for a moment of silent prayer. Please be seated.
We are here to celebrate a momentous achievement by CDAC Trivandrum, which has been honored with the United Nations Interagency Task Force Award 2024 for its exceptional work in the prevention and control of non-communicable diseases using assistive technologies. This award stands as a recognition of our project, Digitally Connected Tribal Colonies, implemented by Health Technology Group, which focus on implementing NCD screening among tribal communities in Wayanad.
This initiative highlights our commitment to improving healthcare accessibility and making a tangible difference in the lives of people through innovative digital solutions. We are delighted to take this opportunity to felicitate the contributors who have played a pivotal role in bringing this vision to life. We are truly honored to extend a special welcome to our esteemed guests on the dais and each one of you as we come together to acknowledge the dedication and hard work of everyone involved in this significant milestone.
We are privileged to invite our esteemed group head, Mr. Subodh Pierce, Scientist G, to deliver the welcome speech and guide you through the history of this project. Under your leadership, we have achieved remarkable milestones in our mission to bring innovative healthcare solutions to those in need. We look forward to hearing your words as we celebrate this significant achievement.
Thank you. Respected Director, Chief Investigator Devanand, Group Heads, Section Heads, my dear colleagues from CDAC Thiruvananthapuram, a warm welcome to you all for this function. Yes, we received the United Nations Interagency Task Force Award 2024 for the non-communicable disease screening activities which we do in Wayanad. It was a goosebump moment for all of us because we could attend the 79th UN General Assembly functions as well, wherein which our Director General could speak a few words about our initiatives. Now, what is this United Nations Interagency Task Force? In fact, all of you know that this United Nations stands for global peace and security as well as for delivering humanitarian aids to various countries. Who is an agency of UN who actually works for the health of all the people across the different nations, and the goal of WHO is to attain good health everywhere and at all times. And this United Nations have created many task forces for violence against women, task forces for sustainable development, and in fact task forces for preventing non-communicable diseases, because now UN has found out that NCDs are one of the major killer diseases across the world. That is why UN has given most importance to the prevention of NCDs. So they sensitize the governments as well as the agencies to do or take measures to do the prevention of such kind of NCDs. Apart from that, they also recognizes major contributors who has showed that their programs have helped in the prevention and eradication of NCDs. In this context, this year, the award nominations invited were for prevention of NCDs using assistive devices. Now, why did we qualify for this award? It's very simple. The work which we have done in Wayanad has now resulted in first level screening of 34,000 members from tribal community, out of which more than 1,500 people were subjected for screening and more than 100 precancerous conditions were detected, and all the detected cases are closely monitored to ensure that follow-up treatment is available for these people so that we could save the lives of these people. So in fact, the technology which we have developed, we already had the technology in hand. These technologies are directly deployed on field after getting the relevant certifications and made good use of to ensure that human lives are saved. So this is the reason why we won the award this year. On behalf of all in HTG group, I formally welcome our director who has always supported this particular initiative, because this is one of its kind wherein which we need lot of special approvals, lot of special decisions to make, for all of which he was always supportive for whatever initiatives we were doing. So I extend my hearty welcome to director for this event. The chief investigator of this project, Mr. Devanand, and he was actually instrumental in motivating as well as designing lot of workflow related things for implementing the NCD screening. I welcome you for this event. I welcome all the group heads, section heads, and all the team members who contributed directly or indirectly to this particular initiative, to this event. In fact, the motto of this United Nations Interagency Task Force is very simple. If you want to go fast, go alone. If you want to go far, go together. And this one project stands testimony to the fact that we are all together in this particular endeavor. In fact, the different groups in this CDAC, starting from finance, admin, HR, plant and service, civil, purchase, quality assurance, and of course strategic electronics group who supported us in the development of the service scan equipment, all were together right throughout this project implementation, and even now we are together. And apart from that, one of the proudest thing which I felt, that whether it be generation A, B, C or generation Z, the one thing that is common among all is that humanity is still there, because each one of the individuals in the health technology group, or be it in any other group who has visited the campsites and supported us, we could see how passionately they work for this particular cause, and that itself is something which we all are so proud of. So when we got this award is meant to each one of the people who is sitting here. It is not about a single person or a single entity. It is an award which we achieved together. So be proud of it and cherish it. So thank you all for helping us in this endeavor. Now, let me quickly take you through a story of how we achieved this, so that you are all familiar with how we could achieve this. So before that, I just want to make one point. One of the PRSD chairman is ex-RCC director. So during one of the meetings, he saw that in our camps, we are having around 100 screenings done per day. So he was kind of excited, because he told that right throughout his career, wherever he has gone for a camp, he has not seen more than 20 to 30 people per day. And many of them are not willing to give the oral smears or cervical smears for this screening. So he was wondering how CDAC could achieve this. I hope we will answer that in the coming slides. And the next important thing is that CDAC is a technology organization. we are focusing on R&D, developing deployable solutions. How CDAC has landed up here doing this particular activity? And what are all the innovative methods that we adopted to ensure that this kind of a screening, this level of screening can be achieved there? So I will request Mr. Deepak Aryu to explain about the technologies which we already had in place, which put us in a good battlefield, wherein which we could implement these solutions directly. Over to Deepak.
Good afternoon all. Service can, I think throughout for implementation of the project DCTC, we have been majorly relying on a couple of technologies. To start with, service can is one major technology, which again has been a pan CDAC Thiruvananthapuram project where multiple project groups were involved. Service can is again a technology where we will process a smear called pap smear. It is typically or conventionally used for screening of cervical cancer. We have developed almost a 7 suite of products, right from preparation of smear, processing it, digitizing it, again visualization of that slide. Again, we have an analysis software which will run on top of this, which will be able to tell a particular smear is having a abnormality or not. So we have a series of technology integrated into that. In additionally, we also have a technology for digitizing fundus camera, because diabetic retinopathy and similar such diseases is also comes under that non-communicable disease category. So we also have developed a system for screening of diabetic retinopathy, which includes an imaging system called fundus camera, and the output of fundus camera is a retinal image, which will be analyzed using an AI software, which again will tell us what is the quality of the image, or whether the person is having diabetic retinopathy or not. So these are all we have developed, and as part of specific project for service scan, and also for the second one is Drishti. So we have developed for and deployed in couple of multiple hospitals. So we were in a kind of scenario where all the systems whatever we developed is come into real use when there is a large population to screen. So the project DCTC, Digitally Connected Tribal Colonies, gave us an excellent opportunity where we can deploy all systems whatever we have developed to the field. So I think.
So that is about the products which we already had and the AI tools which enabled us to do the mass screening. So now a project of this scale actually requires us to access the people or the citizen or the tribal community. How to do that? So if we go directly to the field, we are not going to get access to the people or to convince them to come to the screening camps. So we had to access the citizen using the available mechanisms from the government side, which is through the tribal promoters or through the ASHA workers. So naturally, this project required coordination and collaboration with various state government departments in such a way that they also are in line with us. We wanted them to have a feeling that we are all together in this. So how did we do that? So in that aspect, I will invite Sri Binu PJ, who was instrumental in all such collaborations with the government, especially the Scheduled Tribe Development Department. In fact, the minister has taken special interest seeing the kind of work we are doing there, and he has always given us time. All thanks to Mr. Binu PJ, who was instrumental in all the communication with the departments of Government of Kerala. I will request Binu to kindly address.
Good evening to all. Actually, when implementing this project, we have faced a lot of challenges because the nature of the project is a multidisciplinary one, and various stakeholders are actually as part of this project. So when we are actually prepare the proposal, that time itself we decided to do that The ultimate aim of this project is to reach out to the marginalized people. So we thought that we have to recruit the implementers, the real executors of this project from there itself. So we decided to recruit the employees, staffs from that marginalized community, and we have conducted various training, and we have conducted various sensitization programs there in Wayanad. And similarly, the project is actually the stakeholders of this project is actually not only STDD department. STDD means Scheduled Tribe Development Department. The stakeholders are education department, police, forest department, excise department. They are all using our platform for their for utilizing the system for supporting the tribal people. So our project is actually we need a lot of discussion with the different stakeholders. Actually, minister, the STDD minister, Scheduled Tribe Development Minister is actually look after this project. He conducted various meetings, and under his ministership, he included Scheduled Tribe Development Director, District Collector, then ITDP, that Integrated Tribal Development Project Officer, and Tribal Development Officers at Wayanad districts. So lot of officials are actually as part of this project, and we have to convince the whole team members about the projects and all. So what we did is actually we planned a sensitization program at Wayanad district, and ministry is actually inaugurated that project. And as part of this project, what we did is actually we have actually bring the tribal promoters. The tribal promoters is the main key persons in this project, because they are actually directly connecting with the people, that marginalized people. So we require their support. What we did is actually we conducted a sensitization program at Calcutta with the help of minister, and similarly we sensitized the department officials in that meeting. So a lot of that all officers from the STDD department, and similarly collector, and similarly education officers from education department, police, excise, they all came together, and we conducted a sensitization program to them. So after that, actually we identified that some other sensitization is actually required for in the root level, like that the tribal promoters. We are actually conducted that the role of screening. Actually, Dr. Sujathan is here. He will tell about that, and what is the role of that sensitization program for screening and all kind of these diseases. So we have conducted another sensitization. So lot of activities actually we conducted among these people, and in different time. So that time actually we need the support of HR, because see the persons who are actually working in the root level is actually nurses. So we require to recruit nurses, and they are actually right now in the role of our CDAC enrollment list. So that's actually that we got support from the HR people, and similarly in the finance people for finalizing those kind of activities and all. And after this sensitization and programs, that Wayanad collector is actually developed they are actually a formation of project monitoring committee. They decided to formulate a project monitoring committee there, and the project monitoring committee is actually now reviewing this project. So this kind of different liaison works has been done among the various stakeholders, and finally we are actually now running the project successfully, and they are actually coming to us what are the next plan, what we can do with this platform and all. This kind of question is asking from the stakeholders. That is actually the minimum insights of this licensing and activities. And Mr. Baiju is actually, he is at the backbone of this project. He is actually he will tell what are the screening activities and all is actually provided as part of this project.
Just like the licensing work with various government departments, which is key to the success of this particular screening. We are actually conducting a lot of activities related to screening, and in fact there are a lot of technology fallouts out of the screening activity. So if you ask me who is one of the epicenter of this particular project, I have only one answer, and that is Mr. Baiju. I will request to give a big hand to him. And I will request Baiju to quickly guide you through the various activities which we did in Wayanad. I am saying quickly because each camp or each event or each training itself is a very big story in Wayanad. So I will request to quickly guide you through the photos and other things which we've done there. Thank you.
Thank you. So after the sensitization program, we started our first camp, that is at Manandawadi Mary Mother College, that is on 29th July 2023. Here we are conducting the first camp, that too after lot of homeworks. We prepared a very good plan to conduct the camp, and there we had around 50 numbers of members to conduct the camp, where we got the support from the college, their NSS volunteers and other volunteers also, apart from CDAC staffs, and all the STDD officials along with their promoters. All the STDD road level hierarchies was there to organize the camp. So all together with the help of STDD and DHS, state health system was also there. They will be arranging the medical officers, and we also get support from District Hospital Palakkad for diabetic retinopathy screening, then Malabar Cancer Care Society for conducting pap smear and breast cancer screening. Then also from RCC, their project staffs were involved in screening. So we had a very big group to conduct the first camp, and there we expected around 100 numbers of candidates in the camp. And since the minister was inaugurating the event, around 500 numbers of members were there in the first camp. So before starting the camp, we conducted various levels of cancer awareness. That is, to the promoters we have given cancer awareness, how to bring the members, how to identify the eligible candidates. For that, myself and Dr. Sujathan went to various places to give trainings to these ST promoters, and they became aware how to get the members. Then along with other departments, like MLA was coordinating, conducting the meeting to mobilize the tribes. Then we also formed a WhatsApp group where the ST promoters identified those members, those having clinical issues, and we registered those patients earlier before the camp, so that we got around 173 members pre-registered to the camp. From there we got around 100 members. Then and we also conducted some painting competition. That the theme was health and education, where a number of students, high school students were participated in the painting competitions, when we have given prize distributions, and we exhibited their paintings. And that STTD director, they interested in one of the painting, and she took one painting as in her home. Then since we don't know the college campus, everything, prior to the camp, we visited the camp. We identified various places where to keep the registration desk, where we can conduct the screening activities, then parking, where the report rooms, food, where we can conduct all the things. We prior to the camp, we visited and prepared a very good plan how we can organize, and we made a map and we identified those places. That was homework we did. Then after that, we have prepared a workflow. Suppose if members are more, how we can handle the crowd. So we have made token system, and one person comes, okay, how he will be moving from one places to the other. After registration, we will be giving counseling. Our CDAC colleagues were giving counseling to the tribes members, that is what is happening in the camp, they will be getting motivated to do all the tests. Otherwise, they will not be giving willingness to do the PAP test. So that kind of counseling were given by our colleagues. Then we also made use of, there was 2 mobile telemedicine units running at Wayanad. That was designed by CDAC as part of with the collaborator Sridhara CCT IMST. We got the help of the telemedicine bases where we conducted PAP test, and since we require hygiene rooms for conducting PAP test, so we got the facility of the mobile telemedicine bus that is also designed by Health Technology Group. And with the support of DOMO, we could arrange number of medical officers to do the checkups and all. Then the camp was inaugurated by the Honorable Minister K. Radhakrishnan at that time, and all the medical certificates, everything was given. And along with that time, our project staff joined. We have recruited 50 number of nurses to this project, and they were joined at that time. So before joining itself, we conducted the camp. Then you can see the summary of the camp. That is, we expected a target for 100 number, and around 93 members examined in the first camp. That was across Wayanad. We conducted at Manandawadi, but even from Sultan Bathery people came. We have given vehicle arrangement also. And these are some of the screenshots of the first screening camp. That is, the people are coming that to a rainy day. It was a rainy day in that we have used the raincoats and all. So we were doing counseling, and the STT director was examining the mobile medicine vehicle. And these are the members, they joined in that inauguration. Around 500 numbers of members were there. Minister, all were examining all our technologies used in that camp. And this is the pro forma we have prepared for conducting the, so in that, okay, that time we have prepared in document paper, and now all the pro forma were digitized so that we could now conduct the camps without any paper. And after that, we have recruited the nursing staffs, and the RCC was given 1 month rigorous training to these project staffs on how to conduct the samples, how to do self-breast examination. And these trained members, they will go to the tribes houses, they will give training, means how to do self-examination. All the health awareness was given by these staffs. And for the training, the RCC was given, have given certificates to our training nurses. And after the camp, we have made a standard operating procedures, how to do, means we have made a lot of protocols to do the camp, how to report, how to mobilize the patients, and the SOP was given, has given to the director, district collector by our chief investigator, Wayanad sir. And in our project, one of the motive is to conduct health awareness and screening preliminary screening to our tribal population, where all the recruiter staffs were visiting all the houses of tribes across Wayanad. That too in different areas like Manandawadi, Bathery and Kalpata, there were 3 teams. And currently around, they have screened more than 34,000 ST family members covering around 8,500 houses. And initially they were using papers, and now they were using mobile app. We have developed a mobile app for getting the survey details of our tribes members. That is, the preliminarily screened members were digitized, and from the digitized data we could get the high risk persons, where we will be focusing on the high risk patients for the next level screening, that is the camp. And the first camp, it was conducted at a college. Next, the thing is that in that we are around 50 number of manpower was there, along with other ST supporters and all, and we arranged a lot of staffs from all the hospitals. And we could, if you want to screen the entire Wayanad population, if you see in terms of cost, it lot of like the cost as well as the manpower, it's very difficult to bring for each camp. So we conducted with DMO, and we understood that okay, there are around 30 number of PHCs, Taluk hospitals was there in Wayanad, and we plan to conduct each screening at all the PHCs or CHCs at Wayanad in a periodic manner. And with that, we could get the support of state health system, and we made a proposal plan to our DMO. He agreed that okay, we will be arranging medical camps at each PHCs, starting from Pakam. Then these are the screening camps we conducted at various PHCs. Initially, okay, we were having a lot of members to do the camp. Then okay, we can see that okay, initially even some of the camps, okay, we had more than 100 numbers, like more than 100 members were screened in each some of the camps. And that too, initially we thought okay, we can conduct it at PHCs, but later based on experience we conducted even at Anganwadis also, some of the tribes area. And now we are focusing on camps conducting at their doorsteps, like whether any Anganwadi, any reading rooms, any places where if it is very near to their colony, we will be arranging camps in their colony itself. And moreover, okay, now initially from 50 members, we reduced the number of manpower, and last camp we conducted with a single person, that too not a Malayali. He conducted the camp. That's why we planned that we try to reduce the cost of the camp, we try to reduce the manpower of the cost, then we plan to conduct the camps in any places in Wayanad. Next thing, we try to eliminate the complete use of paper, that is we fully digitized the operations with the mobile, that is by using mobile we will be doing the preliminary screening, with the mobile we will be using the camp, all the data will be directly coming to our server, and from there we can make the report. Then next so these are some of the screening camp pictures, and this is the picture where the last PRC, our PRC chair visited our screening camp, and he was actually examining the patients, and based on our strategies he agreed that okay, he can come on the next camps also. The PRC chair agreed to come for the next camps, so that he can also suggest to make more follow-ups rigorously. Like next plan is to go for rigorous review so that we could save the patients from being affected by cancer. Now, okay, we have conducted various like 30 number of camps, and in order to process the samples, we require a laboratory equipments. For the initial stages, we were collecting the samples and bringing to RCC, where we will be preparing the slides using our developed equipments. Now we transported all the equipments to Wayanad, and that is we set up a screening hub where we can analyze all the slides there itself using our equipments, methodologies and all, and from there we can give our digitized images so that the pathologists from anywhere in India can read the slides, analyze the slides with the use of AI, and give the reports back to Wayanad. And in this project, we have used AI assistants also to help, and I invite Ms. Tara for providing the AI assistance, how we are actually utilizing the technologies for doing the analysis. Thank you.
The application provides AI-assisted disease screening solutions integrated, which can support clinicians for diagnostic support. So what this algorithm does is it identifies or detects 25 highly suspicious regions or fields from the smear images. The clinicians can view those highlighted suspicious regions so that they can do the diagnosis in a short span of time. Now, as Baiju said, this application is hosted centrally so that the clinicians across the country can have access to this application for diagnosis support. Our next focus is in extending the scope of this application to a mobile platform, so that the entire thing from the screening camp, clinical data and this AI integration and clinical review can happen through the mobile device only. Thank you.
So now you might have understood that we have enabled the people to bring more people for the camps, and also we have given training to more than 800 numbers of people in various capacities to do the awareness as well as to bring in people. Now we have the technology in place, the devices in place, the software in place, the workflow in place, and the standard operating procedure in place. Now, what is the way ahead? Can CDAC continue to do this? So there should be a sustenance plan. The sustenance plan is like we have discussed with the minister itself to set up a project management unit under the district collector, and that project management unit will be responsible for bringing in more funds through some CSR initiatives, and then sustaining this particular initiative so that the screening can go on forever. The same model can be applied anywhere, and now we are in a position where in which CDAC can be a consultant and another implementing agency can take over. So this is the overall idea behind the entire activity. Thank you.
As we move forward with our event, we have a special moment that symbolizes our collective achievement. We are honored to present to you the historic moment during the 79th UN General Assembly held at New York. That was indeed a monumental moment for everyone who witnessed this event. We invite you to turn your attention to the screen as we play the highlights of this significant moment.
Category of ministries and government agencies outside health, and we have 3 winners. The first, Center for Development of Advanced Computing, Trivandrum, India. Congratulations. And they are connected with us online. This is a very all our interesting awards for their digitally connected tribal colonies project in Kerala that effectively integrates AI technology and indigenous medical devices to screen and prevent NCDs, including cervical and oral cancer and diabetic retinopathy among marginalized tribal communities, using the local community to provide health education. Congratulations on this award.
Thank you very much.
I don't see them.
May I say a few words?
Please.
Yeah, my name is Magesh, Director General of CDAC. First of all, good morning and good evening to all the UN members and the awardees who have won this prestigious award. We at Center for Development of Advanced Computing, CDAC, so we work on high performance computing, quantum computing, artificial intelligence, strategic electronics, software technology, cyber security, automotive, communication, health. Especially the award which is coming to us is based on the works we have done on the health vertical. So we come under the Ministry of Electronics and Information Technology, Government of India. And I thank the United Nations Interagency Task Force on the Prevention and Control of Non-Communicable Diseases for bestowing us with this prestigious international recognition. Cancer incidence in India is high and is projected to increase in the coming years. In Indian context, mass screening is the only way out for early detection and prevention. The major challenge here is mass screening is availability of resources like manpower and devices at affordable cost. CDAC is especially created to make this technology available to the masses at an affordable cost. So when we talk about all the technologies, our mission is to make that affordable to the masses. This indigenously developed assistive technology is the answer to this challenge. CDAC, in collaboration with the Regional Cancer Center, Thiruvananthapuram, has developed comprehensive systems for assistance in NCD screening using technologies like AI, robotics, and digital pathology. The mass screening program undertook by CDAC with fund support by the Ministry of Government of India and the Government of Kerala successfully conducted door-to-door health awareness across 8,000 tribal families, covering 33,000 family members in the district of Wayanad. The Wayanad is a hilly area, tribal, and most the infrastructure is very poor, and access to health care is very limited. So we have reached out to that isolated areas in that remote area of Kerala and Wayanadu, and follow-up measures has been taken up for the precancerous lesions and connected cases. The program is a...
Thank you so much, Your Excellency.
We are honored to invite our respected director, Dr. Kalai Selvan, CDAC Trivandrum, to the stage to unveil the memento marking this occasion. We also request Mr. Subodh Pierce to hand over the memento to Dr. Kalai Selvan. We kindly request Director to place this memento in your chamber as a remembrance of this achievement. We would like to invite Dr. Kalai Selvan, Director of CDAC, for the felicitation.
So dear friends, certainly we are among very cheerful and proud moments, having received this highly prestigious UN award. I have a feeling of having listened to a great big story, a great narration by the group and all members of the group that involves technical, non-technical, manpower management, coordination. A lot of things are covered. It's very impressive. I can understand the efforts, challenges faced, and hard work behind this achievement. It is not that easy actually. We are basically, we are R&D people. We focus on technical part, and reaching a remote place and implementing such a thing that involves all this common is very amazing actually. So I very much congratulate, appreciate all members of the group, Health Technologies Group, and members of all other research groups who supported this mission, and also all members of the support groups. He mentioned a whole lot of teams involved. So there is a classical example of doing things together in CDAC Thiruvananthapuram. We are known for that. We never claim that I have done it, my group. It's our work. CDAC Thiruvanantham's great effort actually. And the statistics provided by Subodh, the number of people scanned and diagnosed, is very amazing actually. Again, it's not that easy actually. Also, I must thank the great support by Regional Cancer Center and our own ministry, support by MIT for extending all the support, and the state government, our own government, state government of Kerala, and the health volunteers actually, very particularly the local people, who all made this mission possible actually, with very successful results. It's very amazing actually. And this is very much inspiring us. Listen to a great success from end to end. CDAC is basically an R&D organization involved in technology development, products and all. And most of our solutions reach cities or urban or in a different class of section of the country actually. And very few applications like this reach the masses in the rural community. This is very much appreciated. And the work at on-site, we know the burden and difficulty of working on-site. For many projects, not now, right from the beginning, we know how we face a challenge in traveling to remote places, staying back without proper accommodations and all. I always pray for the health of these people who travel on-site, taking all the risk and working for CDAC, compromising many of the comforts of the family and all. I'm really impressed the way this is done. And you know that we under MIT has got a lot of missions, and one of the major mission is rural outreach programs. Rural outreach programs that passes the message of e-governance to the rural community. And this involves many steps, many processes, right from conducting awareness training programs. Even that is very challenging, conducting awareness training program, introducing very basic things and ICT components, information technology, and also some training which are aligned with the industry's requirements also. So it is a kind of end-to-end training, very basic thing to trainings addressing the requirements of the industry also. So that is one mission of the ministry. Secondly, public health, awareness of public health and sanitation, women empowerment particularly, and also infrastructural developments. These are the key points to be addressed in rural development. And so this is all about bringing changes in the rural community from the traditional way of living to a kind of modern or progressive way of living actually. And here the main key factor is about public health. Mainly to provide affordable, accessible, quality, I can say quality healthcare to rural population, mainly focusing the vulnerable, helpless community actually. So that is a key factor in providing this, health awareness across rural community, and this is what MIT is looking for, and that is what exactly expected from CDAC, and that we have achieved now actually. Okay. We reach the community, we are given a basic training, we convince the people, putting a lot of effort to understand this. See, always there was some kind of resistance when you start these kind of missions, right from even computer awareness program. People think, why all these things required actually? But ultimately, the results produced are so amazing. At least you could save some people from we did early detection of cancer and saved some people actually. This is a great achievement really. So this is a classical example of, I can really proudly say, of great leadership and teamwork, commitment and hard work from all groups of CDAC Thiruvananthapuram actually. Okay. I know this is initiated by HTG. They have narrated all the steps taken, and of course it is joint effort by CDAC Thiruvananthapuram to make it as a success actually. Now here I would like to say a point. See, we work a lot on research projects. If you see things happen some 15 years back, I could recently listen to some of the achievements of an SEG, like an echo sounder placed in submarines, working for more than 15 years. We are not aware of that actually. It's just amazing. And the contribution by PEG for the vehicle control units placed in almost thousands of locomotives actually. And work by CAG for whether track monitoring, many are socially relevant projects actually. That's got very high value, and these things are not known to many of us actually. It was very interesting other day when we were presented to our Honorable Secretary. Even though I know something, at least for the last 15 to 20 years, listening to many things, these kind of real achievements of our research groups are not known to many of us, even within CDAC Thiruvananthapuram actually. Someone used to tell me some time back, I think it is our former DGP, CDAC Trivandrum is a very good bunch of R&D people actually, very dedicated actually. It is known across the country, not only in Kerala. I travel across the country for meeting very high level officials across the country. Everywhere this feeling is there. When you assign a job to CDAC to Thiruvananthapuram, they'll get things done. Working extra time, putting huge effort. But he said we lack in publicity actually. We don't declare ourselves. We don't even put our logo somewhere. Like when we executed projects, sometimes either we forget or we are not that much bothered about publishing our own logo of CDAC. We do a lot of work otherwise. But I feel that is also required. See, this award really has brought us into a kind of a limelight. Not only we are known within Trivandrum, we have passed on message across all the CDAC centers, across ministries also, and I passed on the message to our Secretary Health Department, to the highest level actually. Everybody is thrilled and very much appreciated actually. I have shared this message across academic institutions and some organizations also, and no doubt this is a great achievement. So this kind of work is being done in all other groups also, not only in HTG. Every group is involved in very highly valuable, socially relevant national projects. So we have to find some time to have this kind of sessions for sharing what we are doing in other groups also, and we are mutually contributing actually. We don't limit to one group, and we don't take a credit away just with one group. It's a joint effort. We never say it is by HTG alone or a hardware group, software group is involved. Even cyber group, one or other way, every group is involved in in making things successful actually. So I have to especially thank MIT for all the guidance, extending all the support, and only with the support of RCC this has happened, taken to this level, and we are nominated. And we never say we've done a good work. Someone else has to do that. That is done by RCC. It's a great respect to them actually. Otherwise, this would have happened, taking to that level and conveying the volume of work executed by CDAC Trivandrum. Thank you so much for that. And I also like to mention about one of the new groups that we formed called Emerging Technologies Group. Again, the idea is to explore all the latest technologies in providing technological solution for socially relevant projects, mainly about providing helplines for everyone in the country actually, like elderly people or children, women, every community. And today, you may not be knowing actually, we have reached about almost 750 districts of India. Apart from the state headquarters, our team, CDAC Trivandrum, has touched 780 districts of 750 plus districts of India actually. And there is one unit, we call it a police unit or women units, women empowerment unit, which are in progress actually. Wherever you travel across the country, you will see the presence of CDAC Thiruvananthapuram very particularly. Again, I feel it's a great achievement actually. As you rightly mentioned, if you say HTG, it was a small group with a strength of probably 30-40 members initially to begin with, and to achieve this feat, the strength has increased to I think about 80 to 90 members now. Same by ETG also, we started in a lower scale. To achieve this feat, we never depended on private people or anything actually. Everything is indigenous, make in India, made by CDAC Thiruvananthapuram. Even to reach the districts we traveled actually. So we can proudly say that CDAC Thiruvananthapuram is present across the country, in all state capitals and all districts actually. So I look for more sessions like this for sharing the information, and it is not to declare that someone is bigger or greater. Everybody is same actually, equally contributing, and this has happened frequently. So I thank this initiative by the group, especially by the group head Subodh, this particular event also, to bring us together and introduce the work we have done and creating opportunity to mention about other groups also. We are doing a lot of works actually, and which attracted the entire country's top level people. We continue to do that actually. Our strength has increased from not only the group, center strength itself touching 1,350. So that's the indication of the way we gear up to address the requirements of the country. It is not for our center alone. We work on a lot of pan-CDAC projects jointly with many premier academic institutions, organizations like RCC to achieve big things. Okay. So I once again appreciate the entire team for the highly valuable work executed, putting a lot of efforts, and I really wish that this work is now done in a particular place, Wayanad, to be taken across the state, across the country. I'm in touch with the Secretary of Health Department. We'll meet with Subodh soon to take it across the country. We highly appreciate it, and for other countries also. It's a great work. Let us jointly make it to the next higher level. Thank you all.
Now it's time to recognize the outstanding contributions of the members of our CDAC Thiruvananthapuram team who is playing a pivotal role in this project. Finance management in a technical organization often goes unnoticed. The amount of effort put in by the finance officials in timely advice, recommendations of the procurement, as well as for manpower recruitments, conduct of camps, setting up of screening hubs, etc., require a lot of time and effort. We wholeheartedly recognize the contributions of the unsung heroes in our finance department in this endeavor. The names of the contributors are displayed on the screen. As a token of appreciation, we are presenting certificates to Mr. Pradeep SS, Manager Finance, and to all the contributors. We kindly request Dr. Kalai Selvan to hand over the certificate to Mr. Pradeep SS. Thank you, sir. I request Mr. Pradeep to speak a few words.
Respected Director, dear Boji and team members. First of all, let me congratulate you. Once again, we are congratulating you and your team members for bringing laurels to the CDAC Thiruvananthapuram. That to an international award. And we on finance were too happy to associate with you in whatever way possible. I do remember, I think the project we usually call it DCTC. For shorter name, we call it HSC 44D for easy remembrance. I do remember Subodhji coming and sitting with us before the start of the project itself and explaining in details how the project is going to be envisaged. The difficulties, the pros, the advantages that the group has to, the group as well as the center is going to attain is definitely detailed before the project has started itself. And of course, we were also really happy that in whatever way possible, we could help it out at crucial junctions. And one instances I think we remember is that the recruitment of nurses and all that, how the wages has to be paid and all that. And you know, some of the cases like the traveling expenses and extra, of course we didn't stick to the rules. Maybe we just along with the permission of director and all that, we have to pay more for that. And bringing the nurses and even that I think they were to arrange the transport facilities and all that. We didn't stick to the rules. Actually more than that, we just thought about the benefits that the downtrodden house will be achieving on that. And it is really a remarkable achievement. And see, as far as this project is concerned, this is a clear example of how an R&D projects can bring out laurels to the center. Of course, now I think the HSC projects is having more R&D projects. I think we received the award for DCDC. Of course, for other projects like digital industry, then 47D, that BMI, then of course, I think these all projects will bring remarkable achievements. And I think this is all new features which the technical expertise of the group has come into the prominence. Of course, they were having this technical expertise before itself, and now only I think the one person is leading from the front, and that's Subodhji, just like the light is leading. He has come to that and taking the team members as together and bringing about the laurels to the center. Definitely, sir, Subodhji, congratulations. And of course, you are having business projects also. And so, I think 3 years back, the finance divisions were having a review of all the groups. And we were just reviewing how the HSC is going to function, because they were not able to give the contributions and all that. And within the 3 years, they were able to turn around and due to these R&D projects as well as the business projects. And that to the entire leadership and to the team members. Definitely, they were all sticking together and functioning as one team. and that too are reflected in this achieving this UN awards. And congratulations, and once again I request that you just keep it up for the remaining projects also and bring more laurels to them. And lastly, on the lighter side, sir, nowadays I can see that Subodhi is dancing. It is not, I think it's not just because the UN award has come, and similarly another group has started singing also. And of course, maybe after the event is over, you can just show your dancing skill also. And Binu PJ is also there to give the Nadan part also. She will sing the Nadan part also. Thank you and congratulations and keep it up.
Thank you, sir. The relevant, experienced and expertised manpower is the key to success of any initiative. Here, the necessity was for the appointment of medical staff along with the technical team, the support extended by the HR team in formulating and implementing necessary policies and framework for the induction of nurses from Wayanad region itself is a major contributing factor in NCD screening. The employees who work hard for timely actions are listed on the screen. On behalf of Head HR Jagdish, I request Ms. Jayasree to collect the certificates of contributors from our director. Thank you. Head Mr. Jagdish has been kind enough to send us a video felicitation. We kindly request to play the video.
Good afternoon to all. Respected Kalai sir, our group head HTG, as well as other group heads and section heads. Today I am away from Trivandrum, that is why I could not physically attend the program. This UN Interagency Task Force Awards 2024. It is not just a prestigious moment for CDAC Thiruvananthapuram alone. It is for the entire CDAC. It is a prestigious moment, and as well as for our country also. I was just recollecting the situation which led to proceed ahead with this project. See, this project is called Digitally Connected Tribal Colonies. So initially when group head STG, Mr. Subodh, called up and said that we have such a program, we are planning to go ahead with it, what is your opinion? So I immediately, at the first instance itself, I discouraged him. I discouraged him stating that, engaging nurses is none of our profession, because we are into research of electronics and information technology. So immediately, within no time, he stepped into my office, he sat there, he convinced me what we are going to do, and we are going to do something really noble. So that has really moved me. Along with him, Mr. Binu PJ also came. So he convinced me very fast and said that we have to do such kind of things for the society, and we can proceed ahead, we can find out cervical cancer at an earlier stage, so that this can be benefited to the entire human race even. So I immediately got convinced, and I said we'll put our maximum effort. And when I discussed the matter with my teammates, immediately they said, sir, we can just go ahead, we'll do whatever support is required. So immediately we have an outsourced agency with them. They were in the requirement of 30 number of nurses. So we could manage to get 28 nurses at that time, and subsequently we added more. And I was keen to know about the progress of the project also, because whenever I meet him and whenever I used to make a phone call to him, so I used to ask him, what is the progress? Is it going well? So he was extremely thrilled and satisfied with the way in which the progress is taking place. So I am really thankful that I have a very good set of team members, especially Rajesh, Jayasree, and other team members also. they immediately took initiative and went to the spot, and they have recruited people as early as possible. Within no time, we could do that, and that has that support has resulted in this kind of an award. Means it is really a proud moment for me also. So I sincerely vow that I will definitely contribute and help to all the groups across CDAC for these kind of activities from now onwards, and definitely I will be, and myself and my teammates will definitely contribute more, because this is really an appreciation for myself as well as my team members also. So definitely I wish the HTG team all the best, and I assure you all support and help from HR department as well for all the groups and sections. Thank you so much, and thank you very much to my team members as well. Thank you.
Administration team played an important role in the screening activities at Wayanad. We would like to give special mention to the support offered by the team in arranging and providing vehicle to access the challenging terrain of Wayanad. The names of contributors are displayed on the screen. We kindly request the director to hand over the certificate to Mr. Santosh Kumar, Section Head Admin. Sorry, Mr. Santosh X, Section Head Admin. Thank you, sir. I request Mr. Santosh to speak a few words.
Good afternoon, all. Respected director, sir, and other groupers. It's really an unexpected event, actually. Even though Subodh called me in the morning that there will be a function, he has told me 2 days back itself there will be a function. But conducting a function, that is one thing. Another thing is actually remembering the support group, as well as giving certificates like this, even before giving it to his actual team members also, who has contributed to that. Actually, that is a great thing, and he shows that he's a great and a true leader, actually, right? As Pradeep sir was mentioning earlier, and he was mentioning like how the group has evolved under his leadership. So at the very outset, I should congratulate and appreciate Subodh sir, as well as Devan sir, then Binu PJ, Baiju, Deepak, Tara, and all other team members who has worked to get this prestigious award. It's not a small award. It's actually a great award. It's a prestigious award. Maybe it's a once in a lifetime award. Maybe you can call like that, because UN award is not a small thing. So I congratulate you and your team also to, and we have seen all the work we have done, actually. So it's a well-deserving award, I should say. It's a well-deserving award. So I congratulate you and your team for that. And next thing is actually there is conducting a facilitation event like this, actually. So on behalf of CDAC, on behalf of administration group, I take this opportunity to express a big thank you for you for conducting this facilitation, and then giving some contribution awards to the administration group. You know, actually we have done a very small thing, considering the amount of work the project has done. This is just a small thing which we have done in the administration, but he still remembers that and gave the appreciation award for that. So basically, it's a big thank you and all the best. Thank you.
Thank you, sir. As is the case with any project at CDAC, this activity also necessitated a lot of activities. The material management team, along with purchase and stores department, worked wholeheartedly in close association with the technical team to realize the procurement in a timely manner. The major contributors are on the screen. Certifications and process implementation is a key aspect of this activity, since this involves deployment of medical devices developed by us on the field. we are glad to announce that Health Technology Group has implemented process in line with ISO 13485 and also secured manufacturing license for our product from CDSCO. This certification and process implementation were done with the guidance and support of our own QA team. We would like to place on record our appreciation to the major contributors from purchase, stores and QA. I kindly request Director to hand over the certificate of appreciation of all contributors to Sri Parameshwaran Nambudiri, Section Head of Purchase, Store and QA. We kindly request Parameshwaran Nambudiri sir to come forward to receive the certificate and also share a few words with us.
So very good evening, respected Director Sir, Subodhji, group heads and all. ശരിക്കും സന്തോഷം പറഞ്ഞതുപോലെ തന്നെ we are also really proud of getting this award to CDAC, especially to the team led by Subodhji. ശരിക്കും പ്രൊക്യൂർമെൻ്റ് എന്ന് പറഞ്ഞാൽ ഇപ്പോൾ എല്ലാവരുടെയും ഒരു തലവേദനയായിട്ടിരിക്കുന്ന ഒരു കാര്യമാണ്. എല്ലാവരും സമ്മതിക്കുന്ന കേസാണ്. അങ്ങനെ ഒരു അവസരത്തിൽ എനിക്കൊന്ന് ബിനുവും അരുണുമായിരുന്നു പ്രൊക്യൂർമെൻ്റ് കാര്യത്തിൽ കൂടുതൽ നമ്മളുമായിട്ട് സഹകരിച്ചത്. വളരെ ടഫായിട്ടാണെങ്കിലും വളരെ സ്പീഡി ആയിട്ടാണെങ്കിലും ഈ പറഞ്ഞ പോലെ ചെറുതായിട്ട് കോൺട്രിബ്യൂട്ട് ചെയ്യാൻ പറ്റുന്നത് ചെയ്തു എന്നുള്ള ഒരു എന്താ പറയുക ഒരു ആത്മവിശ്വാസം നമുക്കുണ്ട്. അതുപോലെ തന്നെ ക്വാളിറ്റിയുടെ കേസിലായാലും ഞാനും ജയനും കൂടെ ആയിരുന്നു, ബൈജു ആണ് അതിനകത്ത് പറഞ്ഞ പോലെ എല്ലാത്തിനും ഉണ്ടായിരുന്നത്. Any hearty congratulations from on behalf of Quality Purchase Stores and etc. Thank you.
Screening hubs were set up in Wayanad to facilitate the screening of samples collected during the camps. The design, tendering, supervision of construction and inspections etc. were carried out efficiently with the active support and guidance by the plant and service and civil, guided by officer in charge Mr. Jinu Raj and his team. I request the Director to hand over the certificates to Mr. Renji B. Chako, Head of Plant and Service and Civil. Thank you, sir. I would like to... Sir, I would like to invite Mr. Renji V. Chako to speak a few words.
I think congratulations to Subodh and team for achieving this great moment and award. All the best wishes to all the team members. I think the PNS, along with the other team, PNS and Civil will be getting awards from all the groups. We are lucky, we will be lucky enough. Even though the contributions is very less from our part, maybe it is as Director and Subodh was telling, as a team effort, always supporting all the activities one way or the other. Most of the time we will not be much worried about what is the kind of appreciation. Other way, it is coming one way or other. If you are hardworking, the appreciations will come as a success of the projects. In many of the things, it is very successfully running across the things. So it is one of the kind of achievement, really appreciating. So I think we also, as a Power Electronics Group, since I'm heading Power Electronics Group, the group also is having activities with the tribal villages. We understand that about 75 tribal villages in Kerala itself. One of from the information from the Kerala tribal department. So in one of the tribal village at Munnar, we also, our Power Electronics Group also has set up a 24/7 power from the solar grid. There is a saying that even if Munnar city is not having power, the Poravayal tribal village will be having power at their site for the last 4 years. So that kind of activities are happening across. I think we are nowadays the R&D, the CDAC, even though it is advanced computing, we are going into the field and into the common people for a lot of the societal oriented R&D activities and deployments. So thank you all the best wishes for all.
Thank you, sir. The service can suite of products deployed on site has been fabricated with the support of our model shop team. As always, our model shop team has taken deep care and attention to the details which has helped us bring out a truly professional product. We would like to put on record our appreciation to Mr. Rajesh KR, Head Model Shop, Mr. James Verghese, Officer in Charge, and the team whose names are displayed on screen. Intergroup collaboration helps in utilizing expertise of people suitably and efficiently. This project is an example of effectively combining the in-house technical expertise of SCG and HTG in developing ServiceScan suite of products. We would like to recognize the contribution of SCG team whose names are displayed on screen, who actively contributed in the design, implementation, testing and deployment of ServiceScan. Now I invite Dr. Kalai Selvan to present certificate of all contributors in SCG and Model Shop to Mr. Rajesh KR, Group Head SCG and Head Model Shop. I request Mr. Rajesh KR to speak a few words.
Respected Director, my dear friend and colleague Subodh, Devanand, good evening to all of you. And I think some of our colleagues have joined online also. Welcome to them also. So I am standing here representing two groups with pride, SCG and Model Shop. Our team made some significant contributions in the products which got UN award. So first of all, congratulations to all team members, not only from SCG and MSS, but all members who have contributed to get this prestigious award to CDAC. See, SCG is collaborating with various groups in developing technologies. Most of them are challenging and as well as came out successful. For example, ITTS and GVALS project we have collaborated with CAG. Recently, we are collaborating for the bathymetric survey of glacier lakes, in which currently our team is on trekking to Himalayan regions around 4,500 meters from our mean sea level. As the director mentioned, one of the DNA of the CDAC Thiruvananthapuram is the deployment in actual difficult sites. So this is one of such sites. They took actually by walking, they have to cover around 45 kilometers. They took around 4 days because for acclimatization they cannot travel continuously. So every 10 kilometers they have to put a camp, that is a temporary camp. Even basic facilities are not there. Even for toilet they have to go the open places. That is the situation they have worked. And they have completed the survey there and with the indigenously developed bathymetric survey vessel. And now they have reached base camp. All are healthy. So the news got today evening. So SCG team and CEG team was there. So recently we got another project, early warning system for glacial lakes also, that is jointly with CAG. Then we have developed a true imager for cyber forensic division, and SDR, the software defined radio for our CST group. Actually the hardware is done by, that was one of the complex board done in SCG as well as in CDAC, I suppose. And with a 16-layer board that is working perfectly. Now with that SCG is CST is giving the TOT for various educational agencies. Then Intrans sub-project, we have developed a millimeter wave radar and the first version, level 0 autonomous driver assistance system for ITNS. So for service scan, it is having a long history actually. Service scan phase 1 was developed some time back. It was a collaborative project among CDAC, Uppsala University in Sweden, and IIT Kharagpur. Rajesh Kumar R was the CA at that time. I have mentioned his name because I have seen working in the lab for hours to perfect this technology. He done a wonderful job by developing the cancer cell image detection algorithm, which was one of the main USP of service scan. He should have been invited for this function to acknowledge his contribution as well. I think he might have joined online. SCG actually came into picture in phase 2 when HTG was struggling to sell this product as in a TOT, because see, the software is ready, the hardware is not indigenized. Many of the hardware is used from foreign agencies. So at that time, SCG was approached and we developed 4 sub-modules for service scan. James Fergus was taking the lead from the SCG for that. And I will quickly mention some of the modules that SCG developed. All are very challenging. Digismear, it is actually an automated microscope where the XY axis is in the movement has to be in micrometer and Z axis movement should be in nanometer, which was our mechanical team led by James could achieve, and it has been certified by RCC. And then come the chitospin. Chitospin is nothing but, as the name mentioned, it is the centrifuge to deposit the human cells in glass slides. From that human cells, we will identify the cancer cells. So the advantage is that indigenization result in cost reduction of from 2.5 lakhs to 30,000 rupees. Then came the rotostainer. Rotostainer, it is actually a fully SCG product because the previous chitospin, the software was done by STG. The rotostainer is a fully SCG product in the sense that the hardware and software were developed by SCG team. This is used actually for slide preparation. The innovation was here, see, you normally might have seen there are linear arrays to, in some of the videos you might have seen, to fill the slides and then move it in a linear fashion. But here, one innovation came from our team. Why can't we have a rotatory slide preparation? So we have developed, we have faced many issues because the 360-degree angle with an accuracy to maintain is a big challenge, because after one rotation there will be an offset in the angle. So our strong team from led by Nimi, they have corrected that, and finally it has been approved by RCC. Then came the mega funnel and mega clip that we developed. So again, the indigenization resulted in a cost reduction of rupees 100 to rupees 30. So 12 members from SCG as already listed: James Fergus, scientist F, Nimi Matthew, scientist F, Harishan CS, and Rajesh R is on tour to NSTL, scientist E. So they have led the team and they have contributed significantly. And from model shop side, we have 15 members worked significantly in fabricating the units. So we are proud to say that about 50% of the fabrication is done in our internal model shop itself, including the enclosures. And for digismia, rotostainer, chitospin done in our model shop. See, why our model shop team can do this is because they all having more than 15 years of experience in fabrication or welding or machining or painting activities. They all are having turning, they have all having 15 years of experience. So when I took some of the visitors from SHAR, Satish Dhawan Space Center, Sriharikota to model shop, they highly appreciated the precision with which this fabrication of metallic fabrication has been done. So recently we have unveiled unmanned ground vehicle at IIT Hyderabad by our former DG Professor Rajat Muna. So he himself was commended whether it has been actually done by a fiber or actually done by fabrication or metal fabrication. Then Hari was there. Hari explained it was by fabrication. They became very, I should say, very appreciated that development. So that is the expertise. I just want to tell about the expertise because model shop expertise sometimes we overlook. But this 15 year, over a period of time, the experience they gained, we should appreciate really. See, finally now this service can become a complete product with, I assume that along with RCC and other cancer centers, more than 10,000 slides have been tested successfully. So, and now HTG team is going for the SETCO certification. That is required for the medical equipments. Then SCG helped in preparing the TOT document for the first TOT has given to SETTLE. Any other agency? No, the SETTLE is the only agency given for that. So our team, whatever we have done, we completed the TOT and collaborated with SETTLE in hand-holding this TOT. See, one of my observation is, as in any real work product development that is actually used by a user, there will be technical glitches. There will be technical glitches that, and we have seen heated discussions by group members from HTG and from SCG. I think I have seen Devanand came. Normally Devanand is a very calm person. He is not normally agitated, but sometimes because of the technical issues, he will come to SCG and discuss the things. So by joint discussion, we could sort out finding solutions one by one with the collective efforts. Issues definitely will come up when we develop a project. Issues will definitely come up. Otherwise, there is no innovation. It is an easy path. So that is not CDAC is meant for. So my only means with my experience, what we have to do is don't hide the issues at the initial stage or at the design stage. We reveal it to a discussion table or to the PL. Let it be an open discussion. The only thing I have seen in many groups that the designers try to hide the issues because of they may not be able to. So finally, if it is comes to the customer, when the issues comes to the customer, it should be solved before that. So for that we have to be very careful in the initial stage. So I suggest Subodh, since he is heading the HTG now, to document such lessons learned from this project implementation, which will be very useful in our future implementation of collaborative projects as well as in many projects. With HTG, I am concluding with HTG, SCG is collaborating in many more projects like IMRI, indigenized MRI, cone beam dental CT scanner, which recently we have started, DCTC Varnamala project. Yesterday, Subodh suggested we should, SCG should take lead in developing X-ray tubes. That is very challenging. Actually, X-ray tubes are imported. It is a new technology, but always SCG like to take challenging works. So we will see whether we can do it. In future also, we are looking forward to more such collaborations with HTG, because Subodh was from SCG, so we can very freely collaborate. Once again, congratulations to all who contributed in getting this prestigious award to CDAC. Thank you all.
This NCD screening is one of its kind specifically due to the fact that the entire team of Health Technology Group put in their selfless dedication and service on the field for the screening. To recognize their efforts and as an encouragement, we are presenting certificates to the entire HTG team of CDAC Thiruvananthapuram. I invite Dr. Kalai Selvan to hand over the certificates of all contributors to Mr. Subodh P.S., Group Head HTG.
The screening activities, being one of its kind, required lot of special approvals, timely approvals, follow-ups, recommendations, etc. were facilitated by the Director Office team, who managed all these activities efficiently. We would like to put on record the contributions of DRO team in this endeavor. I invite Dr. Kalai Selvan to receive the certificates of contributors from Mr. Subodh P.S., Group Head HTG.
We are privileged to have among us an exceptional individual whose tireless dedication has made a profound impact on cancer awareness across Kerala. With a remarkable track record of organizing over 1,000 cancer awareness programs and camps, his efforts have reached countless lives, spreading knowledge and hope for people across the state. Dr. K. Sujathan, retired additional professor of the Regional Cancer Center Trivandrum, was the chief investigator of this project during his service in RCC. He has obtained PhD in the field of cancer pathology and cytology and worked in the Regional Cancer Center for about 38 years. Upon retirement, we were privileged to have him as our consultant. He was instrumental in giving us the domain support for the development of service scan suite of products. He also supported us immensely in garnering the support to medical and scientific fraternity from various cancer centers. Undoubtedly, his contributions can be termed as this significant contribution in the screening and thereby helping to save precious human life. As a token of our gratitude and appreciation, we would like to hand over a memento to Dr. K. Sujathan. I request Dr. Kalai Selvan to hand over the memento to Dr. K. Sujathan. I request Dr. K. Sujathan to enlighten us on his journey in this effort.
Good afternoon, one and all, and respected director and other dignitaries on the dais, off the dais, HODs. It is really a pleasure to be here in this evening, because I have been in the Regional Cancer Center for the last 38 years. Thank you for your nice introduction. And probably you may not be aware of the significance of this service scan product. As you know, cancer of the uterine cervix was one of the major cancers among women in India. And in 70s, 80s and 90s, our women used to die in their 60s and 50s by cervical cancer. This is a preventable cancer. Cancer of the uterine cervix is a preventable cancer. Most of the developed countries have controlled this disease by implementing systematically organized population screening programs using pap smear. Unfortunately, in India and similar countries, we don't have infrastructure to screen all eligible women with this pap smear. There comes the relevance of service scan. It uses to screen slide images, pap smears, without using much manpower. So if you can screen the whole women, the whole eligible women in our community, in India also, we can control this disease. So that is the relevance of service scan product. It is a very good job done by CDAC. And this award is not for this product. This is for the service rendered to the tribal community of Wayanad district. Usually in RCC, we used to have cancer detection camps. And here, for cervical cancer, we are not detecting cancer. We are detecting the chance to get cancer. We can detect the precancerous lesions if it is left untreated, will go to fatal cancer. So if you detect these precancerous lesions, you can easily treat it out and thereby you can save the life of those women. That is what we do in Wayanad. This product, cervix scan, is being used to screen the Wayanad tribal population. That is why we received this award. And this is the first product in India to use this product to screen the women of the society. And hopefully many of the states will come forward to use this technology, this product to use for screening their population. And right now we have started using this product to screen oral cancer also, because India is a country where oral cancer is a major cancer, and except Asia, we don't have oral cancer. Why oral cancer is more in India? Because we often use tobacco chewing. Our people use tobacco chewing. Particularly if you go to Wayanad, if you ask to open the mouth to anybody from the tribal community, you will be surprised, because they often use tobacco chewing from 5 years onwards. So oral cancer is a major problem among tribals. That is why we are trying to use this product to screen oral cancer also. Oral cancer also has an advantage, because before the onset of the fatal cancer, there will be some lesions which we can pick out using this equipment. If you can treat it, you can save the life of those people also.
This is also basically image processing?
Yeah, same. The epithelium is of same type, similar type. And cervical epithelium and oral epithelium are of similar type. We can detect precancerous lesions in cervix.
No biopsies?
No, we can pre-select
people who require biopsy, because doing biopsy is a difficult task. You have to get a small bit of tissue from oral cavity that you cannot do in a camp. So by simply looking in the buccal mucosa, mouth cavity, you can find some lesions, some precancerous lesions and early cancer lesions. You can select, you can scrape the cells and study under microscope if they are precancerous or cancerous. If it is cancerous, it will be very early stage. It will be in stage 1 or maximum stage 2. That can easily be treated. No, no. We are using a brush to scrape the cells. It is not at all painful. Easily we can do. And here we are trying to use this service scan product to use for oral cancer screening also. So probably many other groups from Kerala as well as from the nation will come forward to use this cervix scan system to screen their population. The thing is, around 90% of the women will be within normal limits. We don't know who are at normal cytology. If you can screen with pap smear, we can select out the 10% abnormal, and that abnormal we can even manually screen. To pick out those abnormal, this machine will be very useful. That is what people do in developed countries. So if you want to screen out the normal from the abnormal group, the abnormal group alone can be subjected to manual if you require. But now the product is ready to give a result whether it is precancerous one or not. And if it refines more, we will if we identify a precancerous lesion, there are three stages of precancerous lesion. If an early precancer, that is LSIL, we often call low grade squamous intraepithelial lesion, then we advise follow up for 3 months. If it persists or if it progresses, we will advise some treatment, laser ablation or thermoablation. It can easily be done. Even in the camp, thermoablation can be done. We have found out around 60 precancerous lesions of cervix, and we are planning to arrange a camp to treat these lesions. Thereby we can prevent the chance of getting the fatal invasive cancer to those women. We are saving the lives of those women. And we have already identified some early oral cancers also. We have suggested them to attend the regional cancer center or Malabar Cancer Center. Okay. Thank you, sir. Yeah. Okay, I would like to congratulate the whole team, particularly Baiju and Binu, for taking all those pain to organize these cancer detection camps and cancer awareness program. I used to go with them for cancer awareness programs all around the district, and most of these people come to the camp. Last camp, our PRSD chairman was also present, and he was asking me, how could you motivate these engineers to the field work? Not for organizing the program, for this field work, because Baiju and Binu were running all over there to mobilize people for attending the clinic. And he has already requested to me to ask Subodh to call him for all the camps. He will come voluntarily. Right now he is working with the Tata Group. He is traveling all around the country to supervise early cancer detection programs. And he told me he has never seen such a camp similar to the one we have arranged in Wayanad. Dr. Paul Sebastian. Yeah. He was the former director of RCC, and he is one of the best onco surgeons available in India. And he is specialized in flap surgery of oral cavity. And he was examining the patients in our camp. I wish Subodh and all our entire team very, very good congratulations to get this award. And I hope we have already suggested some other programs for early detection of lung cancer. As you know, lung cancer is one of the major cancer in India. And similarly, breast cancer grading also we have suggested some programs, because breast cancer is now the major cancer among our women. Even though we cannot prevent the occurrence of breast cancer can easily be treated if we detect the cancer at the initial stage itself. And breast cancer grading is often used to decide proper treatment for the cancer. Right now it is being done manually, which is highly subjective. And I have asked our group to develop a software to objectively grade those cancers. And similarly, colorectal cancer is also increasing like anything in our state, because we often use lot of meat. And previously, colorectal cancer was a cancer of the Western people. Saipinte cancer ennu paranjondirunnaru. But now it is increasing like anything in our state. Yeah, colonoscopy is good, but it is not possible to screen by colonoscopy for all people. It is not as easy as a pap smear. You have to introduce a camera into the colon, and you have to prepare the colon the day before the procedure, and you have introduced the probe into the colon, and you have to monitor the lesions in the colon. It is not easy. But people after 40 years, if you can screen colon by using colonoscopy at least once in 5 years, it will be very useful to identify the lesions at an early stage so that it can be cured. So now most of the cancers are, we can treat most of the cancers easily if detected at an early stage. So devices like ServiceScan, and of course we may be able to develop a system for colon cancer detection, similarly breast cancer grading and all. And lung cancer detection is also another program we are looking into. Those products will help definitely to identify cancers at an early stage. That will be much benefited to our public. Thank you for giving this opportunity. Thank you once again.
Thank you, sir. Mr. Devanand P., Chief Investigator of this project, has been instrumental in guiding us and ensuring the success of the project. His unwavering dedication and vision have not only propelled this initiative forward, but also inspired all of us to strive for excellence in our efforts. It's our honor to invite Mr. Devanand P. to deliver the vote of thanks.
Very good evening to all. Thank you for the kind introduction. We have listened to the journey behind this project over the last 2 years. It was a real journey for many of the team members present here today. So, and the results we have seen the results also. So, if you look at this project is really an example of a collective teamwork where multiple collaborating teams. We have listen to the teams present here within CDAC, but similarly there are teams outside CDAC also from different institutions who have contributed for the success of this project implementation. And that collaborative effort from multiple teams resulted in achieving this international recognition for our CDAC, and it's very happy moment for all of us. And if you look at before giving officially vote of thanks for this function, I would like to mention some of the key contributions from different teams that we have received for this project. Starting from our parent ministry, Ministry of Electronics and Information Technology, our Secretary Ministry, Sri Krishnan Sir, Sunitha Madam, Group Coordinator, R&D in Electronics and IT, and Mr. Rashid Shaban, Scientist D and Project Coordinator, who is looking after this project at MITES. Then, of course, our DG CDAC, Mahesh Sir. When Mahesh Sir was the Executive Director here, at that time this project got initiated and started the activities. And Sir also came here with us for one time to meet the Minister and waited there for a long time, and Minister didn't turn up and we went back. So that kind of support we extended from Mahesh Sir also. And later, after when he became the DG also, at that time also he provided all support to get the approvals and other support from IT also. And also Kalaisulan Sir, as always already mentioned here, for all the approvals, because this is not a normal project, we deliver what we develop and hand over. It is not like that, because we have to implement it in the field. So a lot of approvals specific to that was needed, and Director extended all support for that also. Then from RCC side, Dr. Rekha Madam, who was always the co-investigator, not the co-investigator, director from RCC Trivandrum, who was extended all support for this project implementation, because the training and everything was handled by them. Then other doctors, also from different doctors from RCC also visited Wayanad for different camps, and their technicians and supports from RCC also supported these activities. Then of course Dr. Sujathan, we have already mentioned here, Sir was the key person behind this, because this is a domain totally unknown to us. We are only the technology people, and all the relevant domain inputs and trainings and awareness camps, everything was handled by Dr. Sujathan Sir. Then also the PRC chairman, Dr. Paul Sebastian Sir. Sir was very keen to understand what we are doing there in Wayanad, and even as mentioned, Sir visited there recently and provided all valuable feedback and guidance from the PRC side also. Apart from chairman, the committee members, also there was a technical advisory committee. Their inputs were also very valuable, which was helped us to continue the project activities in a good way. Then Honorable Minister of Welfare for Scheduled Caste and Scheduled Tribes in Kerala, Honorable Minister Dr. Sri Radhakrishnan Sir. Sir was the previous minister. At that time, the major interaction was with Dr. Sri Radhakrishnan Minister, and then later OR Kerala Minister was there. So all of them they supported wholeheartedly for this project, and they have a proper vision how this project should be executed, since they are in that field for a quite long time. So they know how we can implement this project in this, and they give the proper directions for us in that direction. Then from the STDD department, his director STDD, I say director STDD means over this period there are 7 or 8 members changed during this period. So there are a lot of people in that capacity presented there. Then the tribal development officers present in Wayanad, and also the tribal promoters who are the field staff or support staff working there in Wayanad. Then the district collectors, Wayanad, there were 2 or 3 district collectors also during this period when we are doing the execution there. Then DMO and Wayanad and the medical team there. Then medical officers and health inspectors in the Wayanad region, they have also extended all-related support for this project implementation. Then because this is not an easy task to conduct a camp, the one of the major challenge that we face there also is the medical waste there. Even that kind of activities also we need to handle in this scenario, because how to handle this medical waste, Baijo was sometimes behind that also. How to dispose this medical waste without the government of Kerala or the government of Kerala, the health department support, we cannot do anything on that. So they have supported wholeheartedly for these activities everywhere. Then the ASHA workers, then representatives from different wards, Panchayat, etc. in Wayanad, because the local support, that is the most crucial thing. We are saying that it is a success and we got this award, everything is correct. But as already mentioned here, when we look back around 2-3 years back, at that time we were going to implement this project in a region where the beneficiaries are not at all aware of any healthcare facilities. They are not bothered about their health, and they don't know what screening is. So the beneficiaries are such a kind of people, and we have to bring them to the forefront for making use of our technology or whatever facilities. That was the key challenge here. So the real success lies project lies in that area also, because then only we can say that we have done this. So from 2 years we can see the statistics what we have presented here. So without this local support and people, especially from the tribal community itself, with their support only we could be able to achieve this. So that was a significant contribution from the people who are supported from the local community there. So I would like to send sincere thanks to all these people who are all mentioned here, because this award is a result of their contribution also to a great extent. Then regarding this function organized here today, Dr. Kalaiselvan sir actually suggested to organize a function like this because there are a lot of people who have contributed in one way or other to this project activities. It was not a normal implementation activity that we have done here. So I would like to extend sincere thanks to our director, Kalaiselvan sir, Dr. Kalaiselvan sir, for taking this initiative and participating in this function and sharing his observations and appreciations, and also presenting the certificates to different members who have contributed in this project activities. This will be a real motivation for the team to continue the good work and achieve greater achievements to CDAC. Thanks for then the team HDG actually played the lead role in this project implementation, and the project, and as we already know, under the leadership of Subodh PS, we have carried out all these activities. And I would like to mention sincere thanks to Subodh PS also for all the technical guidance, administrative support, and all other activities extended to complete these project activities in a timely manner, and also for participating or supporting these activities organized as part of this event here, and delivering the welcome address and explaining the journey of this project, explaining its impacts and everything. Thank you, Subodh, for this activity. And sincere thanks to STG team members, especially Baiju, Binu PJ, Deepak and Tara, for sharing the journey of this project in a well-structured manner, covering all these activities that we have done during the last 2 years period. I would also thank all the group heads who have attended this function and shared their facilitations. Also, I would like to sincerely thank all members who have joined offline and online to this event and who have made this a grand success. Thank you all, and expect all your wholehearted contribution in your future activities as well. Thank you. Thank you very much.
As we bring this event to a close, our heartfelt gratitude goes out to all of you for your unwavering support and contributions. Together we are making a difference and promising a better life. Let's stand up for the national anthem.
Jana Mana Adhinayaka Jaya He Bharat Bhagya Vidhata Punjab Sindh Gujarat Maratha Dravida Utkala Vanga Vindhya Himachala Yamuna Ganga Uchchala Jaladhi Taranga तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय जय